Thank you for being with us. Appreciate those of you who've been able to join us today to talk about this most important topic. I'm Paula Cunningham, State Director for AARP Michigan, as you know. And with me also is Justin Fast, who is a Senior Consultant for Public Sector Consultants. Very much appreciate your paying attention and giving attention to this important issue. You know, as we all know, COVID-19 has literally shattered our perceptions of reality. There's no dispute that this pandemic has had a disparate impact on senior populations and on people of color. So much so that it has sometimes created misperceptions that this is an issue of race. It is not. It is an issue of long-term, systemic, and structural decisions that have once again reared their ugly head and created, intentionally or unintentionally, inequities and policies that disadvantage older adults and disadvantage people of color. The numbers don't lie, folks. Older adults are being hospitalized at far greater rates for COVID-19 than their 18 to 49-year-old counterparts. 95% of Michigan COVID-19 deaths are 50 and older, and the median age is around 77 years old. And despite making up only 14% of Michigan's population, African Americans account for 33% of confirmed COVID-19 cases and unfortunately 40% of deaths in the state. This report, Disrupt Disparities 2.0, makes a compelling case for how these disparities can be eliminated in proactive, positive ways, as well as save the state millions of dollars and improve the quality of life for older adults and for people of color. And it's important to know that the foundation of this project is the idea that everyone in Michigan should have access to quality health care and the long-term support services they need, regardless of their age, regardless of their race, their ethnicity, their geographic location, or their income. Since the first shelter-in-place order on March 15, 2020, we've heard the problems that COVID-19 has had on older adults and people of color. However, the root of the problem is planted in decades of inequities, and the reckoning of those inequities continues to be felt today. So on behalf of our more than 1.3 million members in Michigan and their families, AARP will continue to spend its efforts and its energy advocating for solutions. We can't afford to wait any longer. The report highlights 4 areas. The first area is home and community-based services. We are all aware of the loss of life in nursing homes due to COVID-19. We understandably continue to focus on nursing homes, but we also need to be aware that 87% of people surveyed, they want to stay in their own home. They never wanted to go to the nursing home to begin with. They want to age in place. And yet our state spends more money to send people to nursing homes than it would cost to have them stay in their own home with the proper support. I don't know if you're aware or not, but Michigan ranks 45th among states in its proportion of long-term support dollars spent on home and community-based services. Other states average around 57% of its Medicaid dollars for home and community-based services, and Michigan averages 43%. People want to age in place, and they can use these dollars or reallocate these dollars to keep them in place and age in their own home. Another area that we looked at is social determinants of health. We've heard a lot about that. Food insecurity is a prevalent issue, that disproportionately impacts many older people of color. They have limited access to nutritional food, which also makes them accessible to other comorbidities and more vulnerable to COVID-19. Michigan has 418,320 seniors who are age 60 and older who are living at or below 150% of poverty and who are at risk of food insecurity. These individuals could benefit from the Supplemental Nutrition Assistance Program known as SNAP and formerly known as the Food Stamp Program. 270,000 seniors who are eligible for this program didn't even participate. We must allow seniors to use their SNAP dollars to purchase groceries online for pickup or delivery. Most of us use this service ourselves, and it's ridiculous that those who are most vulnerable and have issues with transportation, issues with food deserts, cannot use their SNAP benefit to purchase food online. The third area that we looked at was telehealth. And previously, telehealth visits were restricted to older adults, patients living in rural areas who had an established relationship with a provider. During the last 14 weeks or so, I bet many of us have already used a telehealth service. On March 17th, some of those restrictions regarding telehealth were lifted by the Center for Medicare and Medicaid, and that's appreciated. However, despite this, additional hurdles remain: insufficient broadband infrastructure to support telehealth in rural and urban areas like Detroit, a city that was deemed to be the worst connected city in the United States in 2015. Only about 50% of Detroit residents have access to broadband. In a city that is nearly 80% Black, the lack of broadband access for Detroiters reflects racial and economic disparities in affordability and availability. Michigan needs to implement robust telehealth platforms across healthcare practices to keep up with the demand during and after COVID-19. Establishing telehealth as a visible and viable alternative to in-person patient visits can save patients time and money, as well as limit the spread of contagious illnesses. Broadband. We talked a lot about broadband. In 2018, an estimated 368,000 rural Michigan households did not have access to broadband. Social isolation, loneliness have been linked to many physical and mental health problems, including heart disease, diabetes, and depression. It has been a struggle for families to connect to their loved ones during this pandemic. Michigan would see a $2.5 billion boost in economic activity by connecting more than 1.3 million households that don't subscribe to broadband connection. About 12,000 jobs would be created or retained through greater use of broadband, and small businesses would also benefit from this connection. So in conclusion, and I want to turn this over to Justin to also talk about this issue, the coronavirus pandemic has magnified the need to eliminate inequities in Michigan's healthcare system. And we need to do everything that we can and move as quickly as we can and have a renewed sense of urgency. If implemented, if these recommendations were implemented, they would allow seniors to live where they want and age in place. They would increase access to services and supports at 1/3 of the cost of current options. They would reduce the likelihood of seniors requiring nursing home care by 23% and reduce hospitalization by 46%. They would save nearly 25% for seniors in medical costs every single year. And they would increase access to high-quality health care at reduced costs while really spurring business growth in rural and low-income communities. And it would also draw $335 million in untapped federal funds to Michigan, which would generate an estimated $517 million in gross domestic product and allow about 4,550 new jobs statewide. We've seen the disparities. We know they exist. Now it's time to disrupt them. Thank you. I'll turn this over to Justin, and then we'll open it up for questions. Thank you so much. Justin?
Sure. Thanks, Paula. I'm Justin Fast, Senior Consultant with Public Sector Consultants. And just want to thank Paula and AARP. We were really proud to be able to support your work on this project, and certainly to leverage your prior work in disrupting disparities in the initial report on which this work built. Paula gave a great overview of the findings in this report, and I'll just echo and maybe drill deeper into some of the specific findings. First, in that home and community-based services area, as Paula mentioned, we kind of get what we pay for in this space. You hear a lot right now in the news about whether or not and where people are rehabilitated who have had coronavirus. When we look at the numbers, Michigan is essentially the reverse of many other states in our spending on long-term services and supports through Medicaid. We just spend a far higher proportion of our resources on nursing home care and availability than we do on making sure that those services are available to older adults in their communities. And we're seeing the effects of that now during coronavirus. Again, Paula mentioned 95% of all of Michigan's coronavirus deaths are people ages 50 and older. The median age of those dying is 77, and 40% of all of those coronavirus deaths are African American, despite the fact that that represents 14% of our population. Coronavirus doesn't discriminate. People and the systems we create do, and that's a really unfortunate manifestation of the systems that we currently have in place. Michigan would save an estimated $2,176 per member per month for every person requiring that nursing facility level of care were they maintained in a community setting instead of in that nursing facility. Nonetheless, nursing facilities receive that higher proportion of Medicaid long-term services and support spending. And as a result, we've seen Michigan rank 7th nationally in coronavirus infection rates among nursing home residents. That second area, access to healthy and nutritious foods as a way of mitigating chronic disease, is really crucial. In 2018, food insecurity rates were higher than the national average for households that were Black, non-Hispanic, Hispanic, and then households with incomes below 185% of the poverty threshold. So far higher among those groups than others. And on average, individuals who were food insecure had healthcare costs 11% higher than food secure older adults with or without chronic disease. So when we look at a statewide level, in 2016, that was an estimated $1.8 billion, or $182 per capita on average, that the state spent on healthcare costs associated with food insecurity alone. As Paula also mentioned, we have a large number of seniors eligible for but not participating in SNAP, foregoing an estimated $355 million in SNAP benefits. These are federal dollars that we all pay in taxes and don't receive back to Michigan unless eligible folks enroll for and participate in that program. And in Michigan, only about 51% of eligible seniors, including those at highest risk, are actually participating in the program. Telehealth, also very crucial, specifically during a pandemic. Paula mentioned this and elaborated on it well. I'll just add to that an example. In Spectrum Health System's Grand Rapids area, patients saving more than 900,000 miles in trips to healthcare providers during a 4-year period using telehealth. This not only increases access to high quality healthcare where broadband is available, and that's a big caveat, but it keeps people from having to leave their homes and expose themselves during a pandemic. And finally, I'll just echo that all of this is half of the story. Again, we're talking about data here, but all of these data points represent people's lives. And I'll say it again, coronavirus doesn't discriminate. The systems that we have in place are responsible for the inequitable outcomes that we see impacting older adults and people of color disproportionately, and that those systems can be addressed and changed. So to that effect, I will pan back to Paula and some of the recommendations that AARP has made to address those disparities in positive, proactive ways.
Thank you so much, Justin. We will open this up to questions. Please know that these recommendations are based in part on AARP's landmark report, Disrupting Disparities and Continuum of Care for Michiganders 50 and older. And in that report, it was also outlined numerous longstanding disparities in access to home and community-based services in the same areas, social determinants of health, chronic disease, and broadband. So now we'll open it up to questions, if there are any, from any of the reporters on the line. Please feel free to ask your question directly.
Hi, can you hear me okay?
We can hear you fine.
Hi, it's Robin from Bridge.
Hi.
Thanks for taking
Robin.
this morning. So these steps certainly seem logical enough. What has been the holdup, or what stood in the way in the past of making some of these changes? Is it just policy that's tough to change? Is it lobbying? Is it an awareness issue? Just in general, why is it taking so long to make some of these changes?
Excellent question that I ask every single day, and the answer is all of the above. Reallocating dollars for instance, for from nursing homes or from long-term support services to people, allowing people to be able to stay at home, seems like a no-brainer. It's not new money, it's just reallocating the existing money. There are all sorts of lobbying groups, there are all sorts of issues that are attached to that. At AARP, nonpartisan, nonpartisan, nonprofit organization, we just look at people. We're not looking at the policy, the politics of all of this. And unfortunately, sometimes I think politics get in the way. However, this is it's a no-brainer in my mind. Just look at the data. I've looked at it 3,000 times. We've had public sector consultants dissect the data. This saves lives. It helps people to do what they want, which is to age in place. It's what AARP has been about for the last 60 years. Fighting for older adults and for them to age with dignity and to age with grace and to have options. And that fight will continue. We'll continue until we get some changes.
Thank you.
Thank you. Any other questions?
Well, I'll jump in with another one unless anyone. I'll hog the time.
That's
and maybe this is it's kind of a continuation of the last program, but 1/2 of eligible seniors draws down benefits, SNAP benefits, if I understood you correctly.
Correct.
I mean, those are benefits they're eligible for. Why is the enrollment so low? That just seems of everything such a gimme.
Yeah, yes, and there are people who probably have better answers for that question than I do, people who don't access the program, and maybe even Justin, if they've done some survey or research in terms of why they don't do that. Some of what we've learned, however, than Robin, is issues with transportation. They can't get to a grocery store. They can't get to a place that, they just don't have the transportation to do that. Some of the issues is the process is a very cumbersome process to even apply for the benefits. Others aren't even aware of how to apply for it. So there are a multitude of issues that we've heard that are anecdotal. If there's any longitudinal study in terms of why they haven't done it or the transition from food stamps to the SNAP program, I haven't seen that. I don't know if Justin, if you have any information on that one.
Sure, Paula. Yeah, at some point, about half of Americans, 1 in 2, will participate in the SNAP program at some point in their lives. But most people don't know that and probably don't think that's true. So there's a lot of stigma still around participating in SNAP benefits. And again, I just echo that these are dollars everyone has already paid. They're dollars that you've paid in your federal taxes that don't come back to families and households in Michigan for whom they are eligible and intended unless people enroll for the program. So Michigan has done a lot of work in My Bridges to make that easier, but I think that stigma is still a part of the equation. And when people do enroll for those benefits, every time they spend $1, it generates $1.54 in economic activity in their community, which has ripple effects throughout the economy. So these are not dollars that once spent go away. They're dollars that once spent magnify their impact throughout our communities.
And that's an excellent point, because we can remember even as a child growing up, we used to always see people using food stamps, and there was a certain stigma attached to them being in a grocery store using their food stamps. However, just like we do, if they're able to use them at home, if they're able to order their groceries and have them delivered or pick them up, then that stigma goes away. And currently they're not able to do that, and that's absolutely ridiculous. Other questions?
Hi, this is Carol from the Lansing State Journal. I'm curious about who you're targeting with this report, or who do you want to read it, and I guess who are the decision makers that hold the power here?
Excellent question. There's a multi-purpose report. It has many different audiences, and it is designed with the help of public sector. It's been designed to be in sections. You can take, if there's a legislator who's particularly interested in telehealth, we can pull that section out and share that information with that particular legislator. Melissa Seifert, who is our Associate State Director for Advocacy, is on the Capitol or in the state Capitol all the time looking and sharing information based on this report, talking to committees, talking to staff. So that's one. We're also sharing it with our almost 300 volunteers, AARP volunteers that we have throughout the state. and they're going into their communities and they're talking to their communities about these statistics and raising the awareness about things like SNAP or home and community-based services and what can be done. So that's another audience. And also on the federal level, we're talking all the time with our members of Congress about things like the SNAP program. We've had virtual visits with almost all of them. We've had teletown halls with like 6 or 7 of them so far. But we are raising the awareness, and we'll continue to do that until people see the logic in this report. We're not asking, again, so many times right now during these times, people are coming asking for millions, even billions of dollars for certain programs. We're telling the state how they can save money. They can actually save money by simply having the courage and the vision to reallocate dollars, to do the hard work, to figure out how best to do that and make it happen. So this report is really for a lot of audiences. It's for communities, it's for our elected officials here in our state, it's for our members of Congress, and it's for anyone else who wants to read it and also help us beat the drum that some changes need to be made, and they need to be made now. How many more people will have to be disadvantaged and or die as a result of action not being taken? And I don't mean that just in terms of a soundbite. I mean that literally. This could really help save lives, improve the quality of life, and also save the state dollars.
This is Carol again. I have a follow-up question along those lines. What do you see as the root of some of or all of these problems, the disparities for older Americans and for people of color?
How long do you have, Carol? I could talk about it. I could talk about that all the way back to my first grade experience, but it's a systemic issue. Everything from transportation, everything from not having the same access to housing, same access to education, our property tax system, the way it's structured, the schools that people of color go to, and people who are low poverty or low income folks have to go to, in the property tax system, the way it's currently structured for those schools, not having the same access to a quality education, not having the same access to health care, not having a place to go if you're in the city of Detroit or other parts of the state to go to get groceries, to get fresh produce, and you wonder why people have a higher level of diabetes or a higher level of chronic diseases, and they haven't had access to the same just going to the grocery store, which is a full-time job. Transportation. A lot of our folks who have been infected with or contracted COVID are frontline workers, and you've heard those stories as well. So it is a multiplier effect. It's not just 1 or 2 or 3 things, but again, I say intentionally or unintentionally, the system continues to disadvantage certain populations, and particularly this negatively impacts our older adults as well. And again, if you want to call me offline at some point in time or buy me a virtual cup of coffee, I could talk to you about this all day in terms of real specific examples. So,
okay, thank you.
Mm-hmm. Other questions? Anyone else? Well, I know that you all, is there another question? I thought I heard someone breathing. I'm sorry I can't see you. There have been so many hacks, people hacking into systems, so you have to be particularly careful. But I appreciate all of you being on the call today. We are not going anywhere. We are not giving up. We will continue to work to make certain that legislation gets passed. There is some progress being made. There are some steps, some positive signs. We are cautiously optimistic that more will happen. We've got a full court press on this, and AARP doesn't give up. So we're in this fight to win it, and we'll stay in it until we see some changes made, and appreciate all of you elevating and lifting up these messages as much as possible. We're here if you'd like to continue to talk with us or reach out in any way regarding this issue or any other issue that impacts older adults, their communities, and their families. If there are no other issues or questions, anyone? Thank you, Justin, and thanks Mark Kornbeck for putting this all together, and Karina for navigating us through all of it, Karina Eggleston. So I appreciate you all, and if there aren't any other questions, I will adjourn, and we can, again, we'll be available if you need us. Thanks so much.
Thank you.
Thanks,